Hello, this is Dr. Joanne Manson, Professor of Medicine at Harvard Medical School and Brigham and Women's Hospital. I'd like to talk with you about two recent publications that provide insights on the implications of hypertension in pregnancy for the mother's and infant's health. One study sheds light on the treatment of mild chronic hypertension during pregnancy, and the other on new onset hypertension, gestational hypertension or preeclampsia, in relation to a woman's subsequent cardiovascular disease risk. Now, the first study was published in New England Journal as a randomized clinical trial, including more than 2,400 women, a multi-center randomized trial looking at treatment of non-severe hypertension in the chronic hypertension in pregnancy trial called CHAP. Now, in this trial, the women were randomized to either receive medication, most commonly it was labetalol or nifedipine, for hypertension in the range of 140/90 to 160/105 versus not receiving treatment for blood pressure in that range. And they were all randomized during prior to 23 weeks of pregnancy. And this randomized trial showed that the women who were randomized to active treatment with medication did better than the women who were left undertreated for this degree of hypertension. So the treated women had a lower risk of the composite, the primary composite of severe preeclampsia, preterm birth, fetal or neonatal death, or other really adverse pregnancy outcomes. They had a statistically significant 18% reduction. They also had a significant reduction of 21% in development of any preeclampsia and a 13% reduction in preterm birth. There were no real safety signals in the trial and no clear evidence of any fetal growth restriction. So overall, the conclusion was that it's advisable to treat blood pressure in this range during pregnancy, and this trial is likely to lead to some changes in clinical guidelines. Now, the other study was an epidemiologic study published in the Journal of the American College of Cardiology, or JACC. This is from the Nurses Health Study 2, more than 60,000 women who had a history of gestational hypertension, new onset gestational hypertension or preeclampsia during the first pregnancy, and it looked at their risk of subsequent cardiovascular events over a 30-year follow-up period. And it demonstrated that having any hypertensive disorder of pregnancy was associated with about a 63% increased risk of subsequent CVD, and preeclampsia was associated with a 72% increase in risk, gestational hypertension a 41% increase in risk. And preeclampsia was especially strongly associated with subsequent coronary heart disease, more than a doubling in risk, and gestational hypertension with an increased risk of subsequent stroke, about a 60% increased risk. What was particularly interesting was that they looked at the extent to which this increased risk of CVD was mediated by traditional risk factors for cardiovascular disease, such as developing hypertension, being diagnosed with hypertension, diabetes, lipid disorders, or having a change in body weight during the follow-up period. And what they saw was that overall about 2/3 of the subsequent cardiovascular events were mediated by these traditional risk factors, and hypertension was a particularly strong mediator, more than 50% mediated by hypertension, about 16% by lipid disorders, high cholesterol, about 10% by subsequent diabetes, and close to a quarter mediated by changes in body weight. So this study strongly suggested that screening, monitoring, and treating these traditional cardiovascular risk factors, in particular treating hypertension, could mitigate some of this excess risk of cardiovascular events occurring after a hypertensive disorder of pregnancy. So overall, these two studies have really moved the needle in our understanding of hypertension in pregnancy, and the findings hold promise for improving maternal and child health. Thank you so much for your attention. This is Joanne Manson.